anything?
Oh.
Go. Hello and thank you. I'm sorry, sorry. Thank you so much for having me. I'm delighted to be here. Hello and thank you for having me. I'm delighted to be here. Today we're going to talk about the visual approach to a child with Down syndrome. For my abstract, Down syndrome is a condition in which extra genetic material causes delay in the way a child develops, both mentally and physically. A 7-year-old child diagnosed with Down syndrome found out to have ocular motility problem during the optometric examination. Down syndrome is a genetic disorder caused when Introduction. Down syndrome is a genetic disorder caused when abnormal cell division results in extra genetic material from chromosome 21. This genetic disorder, which varies in severity, causes lifelong intellectual disability and developmental delays, and in some people, it causes health problems. I have prepared 3 genetic variations. Let's start with the first one, trisomy 21. The child has 3 copies of chromosome 21 instead of the usual 2 copies in all cells. This is caused by abnormal cell division during the development of the sperm cell or the egg cell. Second is the mosaic Down syndrome. In this rare form of Down syndrome, children have some cells with an extra copy of chromosome 21. This mosaic of normal and abnormal cells is caused by abnormal cell division after fertilization. Third is the translocation Down syndrome. Down syndrome can also occur when part of chromosome 21 becomes attached or translocated onto another chromosome before or at conception. Risk factors, I have also 3. Advancing maternal age. A woman's chances of giving birth to a child with Down syndrome increase with age because their eggs have a greater risk of improper chromosome division. Having had one child with Down syndrome. Typically, a woman has one child with Down syndrome has about 1 in a 100 chance of having another child with Down syndrome. Third, being carriers of the genetic translocation for Down syndrome. Both men and women can pass the genetic translocation for Down syndrome onto their children. So for the behavioral characteristic of Down syndrome, I have language impairment, delayed social development, short attention span, and sensory issues. Case summary. A 7-year-old child diagnosed with Down syndrome was found out to have ocular motility problem. So I have the test and results.
Balik sa so.
Balik sa. So I have prepared a table. I have prepared a table with the test and the results. So for Hirschberg, it is 0 mm angle lambda of both eyes. Extraocular motility test, jerky movement in left and right gaze with no head movement, unable to follow an upward gaze, able to follow downward gaze but with head movement. For the cover and cover test, it is orthophoria. For the fourth test, it is near point convergence test. The finding is 2 inches, which is then converted to centimeter, which is 5.8. That is within the normal limits. Loose 4 prism, positive movement of the eyes in all directions. Loose 15 prism, positive movement of the eyes in horizontal direction. No suppression detected. So for my diagnosis, the patient has poor eye motility problem. And for my recommendations, visual acuity taking is advised to know the ability of patient's visual system to resolve fine detail. Psychoplegic refraction is also advised to rule out any refractive anomaly. For his motility problem, pursuit and saccades exercises are advised. For my discussion, individuals with Down syndrome are at increased risk for a variety of eye and vision disorders. Fortunately, many of these eye problems can be treated, especially if discovered at any early age. The most common eye findings include refractive errors, strabismus, blepharitis, cataract, nystagmus, tearing, and keratoconus. So I also posted my references, and it is that I also posted here my references, the basis of my case report.